Those who are uninsured, or even if you do have a plan, we're talking about the marketplace here. Health insurance presents an opportunity for you to see what type of insurance you may qualify for.
So this is for the Affordable Care Act, Obamacare. Basically, if you're unemployed and you lost your insurance because you're not working, this could be an option for you. So we have business consultant Dustin Nieder with Assured Partners. Thank you for waking up early.
Sally and Lena, how are y'all doing this morning?
We are good. Thanks for taking the time. Hey, you know what? I'm looking at the numbers. I'm so impressed. 4 in 5 people eligible for a $10 plan, 3 in 5 eligible for a $0 plan. So what's included in these? Kind of break it down for us.
Yeah, one big thing that's come across in the past couple of years here is back in March, you had the COVID relief bill, and part of that bill was actually increasing the subsidy that the government was giving to individuals. I was seeing people who weren't eligible for these even $10 or $20 bill policies that you're talking about now be eligible for it based on family composition, meaning how many people are in the family, people's ages, whether or not they use tobaccos to affect the age, and of course their household income. Based on that, the computer really jumbles it up. Algorithm from the government shoots it out, and you get these wonderful subsidies that are giving people really affordable health plans.
Okay, so Dustin, if you do qualify for these plans, let's talk about how they compare with COBRA.
Yeah. The big thing with COBRA, sometimes I see people staying with COBRA even though you might have a $400 plan with COBRA, and then you might have the subsidized plan that might be $20, $50, or $10. Sometimes they stick with the COBRA plan because it gives them access to the employer-sponsored plan, which gives them access to that very large PPO network. Some people just must-have doctors or must-have hospitals, in the network. And sometimes they just don't want to switch that out. Or maybe they've already met their deductible and they're like, yeah, I'm paying more for the health insurance, but I have my doctors, I've met my deductible. I guess each person, it's a person by person situation really to determine whether or not it is a good fit.
Okay, so the best place to start is on the exchange. Remind me the website again where people start.
Yeah, so if you want to get a subsidy, if you want to try to get one of these lower costing lower costing plans, you want to go to either healthcare.gov, which is the government's website. You can call healthcare.gov. They have their own 1-800 number. But there's actually a bunch of third parties now that integrate with healthcare.gov. That's up to you.
Okay, Dustin Nieder, and open enrollment runs through August 15th. That's the date to mark down on your calendar. Thanks so much for joining us here on Wake Up.
Thank you so much. Thanks for having me.
Have a great day.